Hello, everyone. Thanks for coming. Thanks for meandering it down to session B here. Today's talk is going to be introduced by Yang Lu. A couple things for each of the speakers today. We're going to have a 10-minute format, and we'll be up in front here letting you know the 2 minutes, the 1 minute, and when time is up. And I'm just really excited to introduce you all to our first talk today. So Yang, take it away.
All right, thanks. Good morning, everybody. I'm Yang Lu from Emory University Law and Public Health. Welcome to session 2B, Climate Risks in Health and Air Quality. We have our first speaker, Arlene Fiore from MIT. How are you doing? Arlene.
Thanks, Yang. So it's really wonderful to be here in person and with those of you online today. I'm really looking forward to this panel discussion. Are we okay?
Yes.
Okay. Great. Can we hide a meeting hand?
Let's see.
Okay. Just so folks in the room can see my titles, hopefully. In any case, with this first slide, I just wanted to introduce my investigator project team. It's fairly interdisciplinary. As you can see, the folks whose names are in red are people who contributed directly to the shaping of the work that we'll be talking about today. And several are here at the meeting. And so in particular, oh gosh, I think I saw Madame Tao come in the room. So she is in the back there, graduate student at Columbia, working with me. My co-I, Susanna Adamo, is in the back. She's from Season. She has expertise in social vulnerability data sets, different demographic data sets. So please have her expertise while you can. And Cascade Tucholsky, who I think may not, oh yeah, there you are in the back, who has expertise in heat data sets. Also working at Season, he's an Earth Institute postdoctoral fellow at Columbia. And then my stakeholder partner and co-I, Tabassum Insaf from New York State Department of Health, and I'm pleased that we get to be on the same panel today. So I thought I would use the time today to motivate kind of why we're starting to think about correlations between air pollution and heat over the Northeastern US. And I'll end with just showing you some very preliminary first steps in this direction. And the timing of this meeting is fantastic because we're at a point that we really would love to get more input from air quality and health groups to see if we can make the work as useful as possible. So the motivation comes first. We'll see.
Let's see. Sorry.
Comes first from observation. So what I'm going to show you on the next slide, if we can advance it.
Oh yeah, sure. 1 second.
Are just measurements from kind of the gold standard AQS monitor. So we have ozone in the top row, PM 2.5 in the middle row, and just the weather maps during a heat wave from the end of June of 2012. And what I want to emphasize here is the large scale spatial structure of the pollution kind of moving across the eastern US. You can see it gets clean as cold fronts come through and provide relief both from heat, but also from the air pollution. And so really the motivation here is as greenhouse gases continue to rise and climate is changing, we know from the climate community, we expect more heat waves, at least defined as relative to today. And so does that automatically mean that we're in for more pollution? And so what I want to do in the next few slides is show you some work that was actually supported by US EPA, but in which we were using climate models that have air pollution in them to look at how climate change affects high pollution events over the eastern US with a focus on the Northeast. And so these are the two climate models that include for the model on the left here, climate model number 1 has full ozone and fine particle chemistry. So we can look at both ozone and PM 2.5 in that model. The one on the right has just the PM 2.5 in it. But what we see is that under this fairly high warming scenario in which the Northeastern US is warming by over 4 degrees by 2100, which is about 7 degrees Fahrenheit, we see that in these two models. But in addition, if you look at the broad range of climate models, whether or not they have chemistry in them, the Northeast is starting to emerge as a hotspot for future warming. So kind of raising the profile of why we might care about what's happening, not just with heat, but potentially also with air pollution. And so in the interest of time, I'm not going to walk through the details, happy to talk about them offline, but we had applied a statistical methodology to identify regions where air pollution and temperature tend to go up and down together in space. And so what we're defining here is this Northeastern US region. And basically where you're seeing the dark reds, this metric that I'm plotting, the number of days in the upper quartile, is when PM2.5 concentrations go into the upper quartile on any summer day, kind of across that whole region. And what we see, we're just plotting a time series here. This is in one of the climate models that I mentioned previously, and we have 3 realizations or ensemble members, which basically just means we're starting out with slightly different initial conditions. The greenhouse gases are rising in the same way in each of these scenarios. We see it's very noisy, but we do see that over the course of the century in all 3 of these ensemble members, we have an increase in the number of days where PM2.5 in that Northeastern US region is going into the upper quartile, where we define the upper quartile relative to the whole time series. Okay, so this suggests that just because greenhouse gases are rising, we're seeing an increase in the number of PM2.5 events. Importantly, what I hadn't told you is these are simulations where we held air pollution emissions constant at 2005 levels. We also see a similar story for ozone. Okay, we were also interested in how duration is changing. So in other words, are we now exposed to high PM2.5 events for longer just because the climate has changed? And so we kind of embarked on this counting exercise where we said, okay, once I go into the upper quartile of PM2.5 concentrations, how long do I stay there? And I do that for each of these ensemble members in the 2 panels or the 2 separate climate models. And we count 1 to 2 day events kind of separately shown in black. And then the longer events are ones that last 3 or more days shown in red. And each individual little circle is a different ensemble member. The point I want to make here is that if you look at the last 3 decades in this climate model number 1, you see that the number of these longer lasting events are totally outside what was simulated in the first 3 decades of the century, suggesting that there is this extended exposure to high PM2.5 events just because greenhouse gases have risen. We see a similar but perhaps less pronounced story in this other climate model where that final decade of the century is emerging outside of anything that was simulated in the first decade. Okay, so this is fine, but it's a little bit of an academic exercise in the sense that we know that emissions have been changing due to our emission controls implemented under the Clean Air Act. And so this has really kind of led us to think about how can we use the best data sets, including those that incorporate satellite data, to understand how ozone and PM are changing during heat events in the Northeastern US over the past few decades, when we know that emission controls have been going into place. And additionally, we're also very interested in trying to connect this to thinking more about equity and how these changes are associated with different vulnerable populations. And in addition, thanks to Susanna Adamo, we have data sets that say how social vulnerability has changed in space over the last 2 decades as well. So there's a lot of data sets we can potentially bring together. And so I just want to quickly outline the different I'm sort of thinking of this as like a multi-pronged approach. There's different types of analyses we can do to try to get a sense of this combined, how the co-occurrence of ozone, PM, and heat, and how they have been changing over time. The first is that we might want to think about developing heat metrics or using heat metrics that are most relevant for health. So things like heat stress, and this is where Cascade Tobulski's work is helping to provide some data sets there. We're starting to look at day-to-day correlations among these variables. And we're also interested wherever possible to bring in multiple data sets to kind of get a broader perspective and ideally identify robust results. And then finally, we're also beginning to think about how we might composite air pollution on, for instance, high heat days versus potentially like normal heat days, and look at how those changes are happening over time. So in my 2 minutes left, just very quick results, 3 slides. The first is just to show you that Cascade has this daily heat stress data set. There's different metrics being developed, but an example is shown here of wet bulb globe temperature exceeding 28 degrees C for New York City. This gives us multiple decades of data. A preview of Madame Vitel's flash talk that I hope you'll join for later today, where she's starting to look at these correlations between ozone and PM 2.5 at very high spatially resolved data sets. These are developed out of Joel Schwartz's group, including Chandi, who was her data set was mentioned in the talk from Allison this morning. And so these are kind of already data sets that bring a lot of information together and available on NASA CDAC, which is housed at CSUN at Columbia University. And again, Susanna Adamo in the back kind of is the project scientist for that. And then some very preliminary results with a coarse 1 degree by 1 degree resolution set of data that we used in the earlier work that I showed you in the talk that was just published earlier this spring, just because it was easy to work with these coarse data sets. But the idea is we can repeat this kind of analysis with higher spatially resolved information. I'm showing you 1999, which was a hot summer, and 2012, which was even hotter. The number of days where the daily maximum temperature goes above 95 degrees Fahrenheit. And all we're doing so far is saying, okay, on those days, for example, what are the ozone concentrations? And what we see is they were a lot higher in 99 than they were in 2012. And so again, this is just one summer. We want to do this in a more systematic, rigorous way, but it's certainly suggestive that there is some good news in this heat and air pollution story, that our emission controls are helping to reduce exposures on the hottest days. And so I'm really looking forward to this panel discussion and talking with folks at the meeting. And I think I'm out of time, so I will stop there.
Thanks, Arlene. We'll hold all the problems, no, sorry, all the questions, all the questions to the Q&A session. Our next speaker is Insaf from New York State.
Oh, yeah, sure. Here, 1 sec. There we go.
Thank you. All right. Hello, everyone. So my name is Tabassum Insaf. I am from the New York State Department of Health. I serve as the research director of our Bureau of Environmental and Occupational Epidemiology. I am primarily involved in our climate and health program. And I've been involved with using NASA data for that program, and now we're branching into air quality with Arlene's collaboration here. So this one. Okay. All right. So I was planning to kind of give this talk around our policy aspects of using some satellite data to inform policy. And just to give you a context of where we are in New York, the New York Climate Leadership and Community Protection Act was passed in 2019. And it's supposed to be one of the most ambitious acts of climate policy in the United States. We are looking to reduce emissions, 40% in emission reduction from 1990 level by 2030, and 85% emission reduction by 2050. So, and there's lots of different health aspects that are tied into these. Some of these are like creation of a climate action council where DOH partners. And then there is, more immediately, we are developing a statewide extreme heat action plan. And we are also involved in doing New York State, actually revising a New York State climate impact assessment. So some of these assessments and policy initiatives can certainly use satellite data inputs. And I'd like to share, some of the ways that we are planning to use these. All right. Some of these collaborations would not be possible, or these tool developments would not be possible without academic collaboration. So, as stakeholders, we are reaching out actively to academic collaborations. And in the past, we're doing these with Columbia and MIT right now with Arlene's work. And then in the past, we've engaged with USRA, University of Alabama, Huntsville, Florida State. We use a lot of research grant support for these activities. So we've used NASA ROSES funding, HAQAST funding, and then from CDC, our bureau also houses the Environmental Public Health Tracking Program, which we use for tool development, and the CDC BRACE program, which is used for climate adaptation and mitigation activities that are actually informed by some of these tools and research that we do with NASA products. And then we actively engage with other states, broadly within the CDC network, but within these NASA ROSES and HAQAST activities, we work with the New York City Department of Health and Mental Hygiene and Florida Department of Health. And then we bring in a lot of different stakeholders, end users, community groups as well. A big collaboration has been with actually our regional offices at the National Weather Service. And so that's been, within this realm of heat and air quality. And I'll talk a little bit about that collaboration a little bit. All right, so why use NASA satellite data? On the right top is where we were in 2012. This is our in situ data sites, the historical climatology network that we use to look at climatology in New York. As you can see, they're sparse, the monitoring stations are sparse, and we actually had counties where there were no monitors. This has changed. We have a MesoNet network, a very rich MesoNet network, looking at temperature in New York, but again, that was put together in 2016. So it does not give us a longer time series to look at climate as a whole. But for more immediate effects, that's a great network. If you do spatial interpolation, we still have gaps in there. So we've moved to using NLDAS data set, which is the National Land Data Simulation System at the 12-kilometer grid for climate. And then with NASA ROSES funding, we actually downscaled it using MODIS LST to a 1-kilometer data set. And that you can see, provides us a really dense and spatially contiguous surface to look at local effects like urban heat islands. I mentioned National Weather Service, so we had a great collaboration with them, and we were actually looking to see, how do these heat advisories happen? And the heat advisory for New York State was at 100 Fahrenheit. If you live in New York, we don't see 100 Fahrenheit days, And so, and if you look at the risk ratio for heat effects, so the plots are different health outcomes: heat stress, acute kidney failure, dehydration, cardiovascular disease. Heat stress, the most immediate health outcome. You can see that there is, a huge risk. It's about 2.5 for heat stress at 100 Fahrenheit. That's double the risk at the 60 Fahrenheit temperature. If you reduce that warning to 95, there is still a significant risk, but that risk has, decreased a lot from that 100 Fahrenheit. So that's what we, brought to them, that actually the risk starts to happen at 83 Fahrenheit. That's that red dot. That's where the significant risk starts. But the National Weather Service was concerned that if we start issuing heat warnings at 83 Fahrenheit, there'd be, warning fatigue. People wouldn't, if you're issuing a warning every day, they're not going to listen to it. So, the happy middle here is that we got our regional offices to change the weather warnings to 95 Fahrenheit for more than 2 consecutive hours. This captures a high proportion of the heat event, but then avoids the warning fatigue, like I said. The other, interesting angle was a lot of the climate effects are concentrated on city, right? All of the research is concentrated on city. Rightly so, they're densely populated. We see the urban heat island and we see the higher temperatures. But in places like New York, we don't have air conditioning in our houses. A lot of people go out for recreational activities in the summer. So as the climate heats up, we are starting to see as significant effects in rural New York State as in the city. So that's something to keep in mind in terms of policy. NICE has been a great collaboration. We were, they have promoted our work, we promoted this work. So that's great to get that exposure out there, to see that the satellite data is being actively used. And like it mentioned in my question before, we've developed these tools using the NLDAS data and the downscale data. I think one of this is video, which I don't know if it'll work. Well, maybe not. So this is a slider that you can actually look at 1979 to 2016, compare the anomalies, the change in heat, and what you're looking at is a regional change. So you're looking at the norm for that specific region and looking at the change. So that kind of gives you, even if you don't get those extreme heat days, we are actually seeing a warming of the climate across the state. We've developed county profiles for each county. Again, that's the, you can see the warming in the more recent years. We are developing a dashboard that will have these effects. And then we're doing some regional climate and health adaptation workshops for our local health agencies. And going back to this new recent project, as Arlene mentioned, we are trying to use some of the work that will come out of the project to then inform and use the heat vulnerability indices that we've developed, inform it with the new vulnerability indices being developed, and then include it into our climate health impacts compendium, which is something that we are developing for our CDC GRACE grant. So coming back to air quality assessments, there are a lot of policy provisions for environmental justice. And we think that the satellite data can be used to look at baseline risk within communities. So the map on the right is something that we've done for traffic density and asthma exacerbations. And that's basically looking at a model where the traffic and other social determinants were used to predict asthma exacerbations. And what that gives you is giving you a baseline where this is the risk for the communities using these air quality data, and then you can evaluate the reduction of burden in specific communities based on the disadvantaged community criterion that was developed in the state. So finally, I just wanted to quickly kind of from a stakeholder perspective talk about what works and what doesn't for us with using satellite data. Let's do what works. So, the academic collaborations have been great. We need those to, kind of understand and interpret the data. The adaptability to shifting priorities with the political will. So right now the climate is right for New York. We have all these policy implications coming in. And we can use the satellite data to then, quickly adapt to what's coming out of the legislation and make the tools. The engagement with National Weather Service and the local stakeholders and policymakers has actually given us the right set of mind to come up with tools that are, that are usable for these efforts. And then translation research. So, we just don't want to end up with a paper, although those are great when you get that, but we want it to be able to be translated into policy. So, as you develop your foci for research, please take into consideration the stakeholders and what they need, and what would be, easily applicable to them. The challenges have been, as a state agency, we have limited IT GIS support. So we have to be, kind of thinking about what needs to get done. We need to have some guidance from you guys about which data sets to use, how much of it has been validated. And then there is a lot of focus in this community for real-time data, for really fine spatial scale, which is very applicable for immediate needs. But for policy, for climate policy, we are looking for longer time series. And we are looking, the data doesn't need to be real time, but it needs to have, at least that the health data is at the daily level. So that's what we are going to be using to do the health studies. Similarly, spatial granularity. That is great when we are looking at individual health outcomes, but for the tools, the stakeholders, the local stakeholders, the health departments are using things at the census tract level. They can't go beyond that. So, that's again, a balance that we have to maintain. I already mentioned sustainability and expansion in our previous talk. So, that's again, something that as stakeholders, we are looking for guidance on how to keep this going. And then interpretation again, we're looking to your community to interpret these data and make them applicable. And I think that's it from my talk. Thank you.
Our next speaker is Chris Uejio from Florida State.
Hi, folks. I didn't take a liberty to do a bit of a less traditional talk, but I'll still have some research stuff there too. What are safe indoor warm season temperatures, right, inside of buildings? Is what I'm trying to get. And this is really just a bit of what I'm thinking about, and I really encourage you to share what you're thinking about too. But I'm just trying to wrap my head around sort of NASA products, different heat exposure metrics, and health outcomes. But just to make sure that my obligatory slide, extreme heat is the #1 killer of people, weather-related killer of people in the United States, more than hurricanes, tornadoes, et cetera, combined. But just to make it slightly more interactive, which I think is particularly helpful if you're online. but roughly, how many people do you think die of extreme heat per year in the United States? So that use a more broader definition, not those that are it's maybe recorded on their death certificate, but where heat has contributed to their death. So maybe I'll have both online, and feel free to just shout it out if you're in the room. Any numbers, orders of magnitude? 700, wonderful.
Hundreds?
Hundreds, awesome. Hundreds, 100,000, awesome. Possible in our worst years, for sure. Put it up or down, huh? Others? Globally. Let's see. Nothing chat. Okay, just usually if I'm at home watching on the webinar, makes me at least pause. So we have about, depending on which study you look at, 12 to 20,000-ish. Right. Again, that's aggravations of the most broad definition. Okay, so I'm just trying to think about the different heat exposure metrics. So by and large, in epidemiology or public health studies, when they look at heat, most of them will look at temperature measured at a 2-meter height, right? Or a height that's relatively invariant to the boundary layer. They're getting better over time. They used to only look at one station. Maybe they'll look at a handful now. But that's one literature is my main point. And we have the second literature, notably smaller literature, of heat vulnerability studies that have looked at surface skin temperature or land surface temperature. So a bit of an analogy. Many of you know from COVID now, if you've had a temperature scanner to your forehead at a distance, infrared scanner, that's somewhat similar to surface skin or land surface temperature. It's related to your internal or core body temperature, but they're not exactly the same. Right, so these land surface temperature has been used, sometimes averaged only one scene, sometimes averaged over maybe 20 or 40 scenes, but maybe not a huge number of satellite-based images. But has also shown some relationship to health outcomes. So just to summarize that, there's obviously these are related, but it's temporally and spatially dynamic. Sorry, I like to move, but I stay here. And by and large, most of it's related to temperature 2 meters in a smaller but growing number of studies looking at land surface temperature. Now to sort of remix this a bit, why I'm talking about indoors is that we know that people in high-income countries like the United States, but elsewhere, spend 90% of their time indoors, right, at their home or at their workplace. So just very broadly, we know that outdoor and indoor conditions are related, but very loosely. roughly a 1 degree increase outside leads to a place like New York City, a 0.2 degree increase inside. The other population that we might be interested in, if I'm dividing it by indoor and outdoor, would be outdoor workers or people who are exercising outdoors or athletes. There's a whole variety of other metrics that others like Cascade and others have looked at, which I won't go into fully, but for me in my mind, when I'm trying to wrap up where the relationships between these heat metrics and health is sort of a potential useful way to separate them. So potentially, as to summarize, temperature 2 meter height, most commonly used in public health studies, loosely related indoor exposures, and then that's related to a broad set of our health outcomes. Land surface temperature, even though it's not the same as temperature at 2 meters, may still contain some valuable information. And that's only based on a really small number of studies. But some studies suggest that it does contain, or as a proxy for, some of the radiative components of heat stress, particularly if you're outdoors. So even though we know that they're different, there could be a case to still use land surface temperature in a public health study, even if you're able to get temperature at 2 meter height. So that was the first part of the talk, just trying to wrap my head around this. Love to hear your thoughts. And then I'm going to transition to just a general research talk. Do indoor heat exposures alter the odds of heat sensitive emergency distress calls? Or in other words, what's a safe indoor temperature for our sickest individuals in society? So in brief, we worked with Grady in Atlanta as emergency medical services. They carried temperature humidity sensors indoors into the households of patients receiving emergency care. And there we could sort of correlate that with routinely recorded records for health outcomes. So we can try to get at this through an epidemiological case control study. I won't go into the weeds of the study design. This is sort of the biorhythm of how these controls, the frequency of these calls over the 24-hour period, averaged over the summer season. So one, like, it's fascinating if you talk to medics, they'll say, like, yeah, there's a certain time of day we see people who have more heart attacks. I mean, very grim stuff, but from a neuroscience and health perspective, quite fascinating. So I'll just show this one, exacerbations of diabetes conditions, type 1 and type 2. We see that we get a peak where we might expect slightly after the hottest periods of outdoor conditions, but also when people are coming home from the workday and maybe their glucose levels aren't that well controlled. So a little bit of both there. Respiratory, which actually also did show relationships to indoor conditions, which I won't talk about as much. Showed more of a bimodal late evening or early morning peak versus sort of our control, which was all of the other non-heat sensitive calls, which to be honest, since heat affects quite a few things, is maybe about 40% of the other calls. So at an indoor heat index about 30 degrees we start to see an increase in your odds of making a respiratory, but also a diabetes related call. This is expressed in log odds. Just to review, a log odds of 2 says that's about an 80% chance of that happening. Diabetes, so about 40 degrees indoor heat index, which is really hot. You're going to get an 80% chance of a diabetes versus another non-heat specific related call. So what does this mean for diabetes? There's been some controlled studies where they literally will have people go into chambers and expose them to high levels of heat. Some people might, and when I told that to my partners, that's kind of awful, right? But there's no other way to get at this information. They've done that with people who had well-controlled diabetes, and actually their physiological responses are similar. So this suggests a place like Atlanta, where we have a population with people who aren't insured and have uncontrolled diabetes, that actually heat is most of the problem for people with uncontrolled diabetic conditions. And then normally I start with this, but there's a really small literature on what indoor conditions are harmful for health, maybe 10 or 15 studies reviewed by the World Health Organization, and really relatively low indoor heat exposures, 28 to 32 degrees C, particularly if you have pre-existing health conditions. So really not high heat exposure levels. So thanks for your time.
Last speaker is Ebrahim Eslami from Houston Advanced Research.
Sorry, I kind of made it a little tough. Here we are.
Hello, good morning, everybody. I'm Ebrahim Eslami. I'm a research scientist in Houston at my research center with emphasis in air quality. And I work a little bit on the climate side as well as the air quality modeler and the particle modeler, and a lot of health impact analysis studies. So for this presentation, I picked two of our recent and ongoing studies down in Houston, focused on community scale outcome of the research. The first one is the future, how we can estimate the heat-related health impact of the future climate scenario. And based on that study, we'll build up the monitoring campaign of mapping Houston's hotspot with the heat index, and how we can come up with the ideas of a mitigation strategies. So let me start with the introduction of our entity. Houston Advanced Research Center, we call it HARC. We are in this September we'll be celebrating our 40th anniversary. So we are relatively old in terms of the sustainability organization, nonprofits. We are nonprofits. We're doing independent research analysis in the field of energy, equality, and water. Down in Houston, it started in Houston region, it's County and Texas, and we're building up to expand to nationally and internationally. And we are a non-advocacy group, so we don't go after anybody. So that's why it gives us a better way for communication to the government entities, communities, and even academia. For the first study, we try to improve our understanding of estimation of the heat-related health impact of climate change in Harris County. It was part of the Nacho grant, the part of CDC's base grant, segment 5, and with collaboration with the Harris County Public Health. As Chris mentioned, we had a lot of heat-related deaths in the United States, around 700 nationally, since this is based on the data of CDC codes between 2006 and 2019. And but this number is increasing each year. In Houston, larger metro region like Houston is a little bit higher. It's 3 per million of population per year, which is generally increasing trend. And the need for this project was to have a local study that discusses the heat-related health impacts in fine resolution, at least record level, and it should be easy to follow process for scalability with other problems of this county or other counties with the same problem. And for this project, we use 2 different sets of the unique data, the climate data and the health data. For the health data, we use the CDC's Sense data, which is which includes the mortality. We use mortality and ER visits at daily levels for all ages for Harris County and extended communities, which has a special resolution of at zip code level. And we only consider the Harris County, as you can see here. And we use the history of around 15 years between 2006 to 2019. We had data for 2020 and 2021 because of COVID. A lot of data was probably messed up, so we removed that to make sure that we got the unbiased analysis here. For the climate data, we use the daily temperature, max and mean, and relative humidity max and mean from the MECA, CMIP5 3 downscale climate projections for 2 different climate scenario, RCP 4.5, which is intermediate emission reduction scenarios, and the business as usual, which is RCP 8.5. We tweaked a little bit using the models of ST to get a little bit more resolution and a little bit less bias to better understand the locality of the study. But eventually the spatial resolution is around 6 kilometers in Harris County, and the history is 2000-2005, and the projection period was 2006-2100. And I didn't went through the analysis part because it was short. I want to discuss the result more. We use the EPA's BEMMAP tool. It's a GIS space that incorporates a lot of available data in the field, but there weren't any health impact function inside the BEMMAP. BEMMAP is designed for air quality specifically for ozone and PM2.5. So you have to build your own health impact function or concentration-based response function, as it's called in BEMMAP. And because we had a very good running year of fine resolution health impact data, so we were able to develop our own health impact function using the one algorithm called ZIP, zero inflated Poisson methodology. And we developed our own health impact function for Harris County, which is very similar, a little bit higher than the national average, but we only had a few studies that discusses the health impacts of heat index per se, but the function that we found was very close to national, a little bit higher than national studies. This is one example of the BEMMAP outputs for the Houston region, and for this one, the baseline scenario was 2006 to 2019. This was these 5 years were our baseline, which every other scenario should compare to. This is the current situation basically. The control scenarios we segmented every 5 years. So this is an example in 2040 to 2044 for the ICP 4.5. As you can see, the hotter, the more green bluish is for the region that we get more excess mortality here. As you can see in the western region of the city, similar to the climate data, and also a lot of population lives there, so we get more excess deaths or more excess mortality for this particular scenario. And this is very actually interesting and important because recently there were a lot of air quality issues in the western part of the city, as well, specifically for PM2.5, which TCQ recently tried to address those issues as well, so because we don't have much of the monitoring in terms of PM in western part of the city at this time. So the coincidence of these two is very interesting. And this is the analysis of the entire scenario. This is the left right hand side of the plot shows how the heat index changes throughout the years from 2010 to 2100, 2099 actually, in 2099. And the right hand side plot shows the excess mortality according to BEMMAP with change of the heat index. So generally, you can see it's a very relatively linear link between the excess mortality and change in heat index. And based on the BEMMAP output, they calculate we have around 83 excess deaths associated with every degree Fahrenheit increase in heat index for future climate, which is huge. It's like more than 4 times of what we have at this time. For the scalability, we developed a digital twin machine learning based model using the cyclode encoder that combines the climate model, the health data, and the weather observation data, which include the model LST as well, to build a smart version of the health impact modeling that will help to scale the scalability of this issue for the other countries and the same other issues like air quality issues in the same counties. And at this time, we're trying to add the air quality model and air quality observation data inside the climate models and climate scenarios. This is relatively hard job, and it's a lot of very few scientists are trying to do that. Extrapolate basically the air quality alongside the climate model. So that's what we are doing at this time for this project. That project was a motivation for the other project, the mapping Houston hotspot. This was a multi-entity effort to monitor fine resolution, the fine resolution monitoring of the heat index within the city, not the entire city, 30% of the city, but still it was the largest attempt throughout the country. It was part of the HAQAST strategy grants, and HARC led the citizen scientist part of that, which was the monitoring campaign. And based on the study that I showed, we selected the different communities to go to develop a monitoring campaign, and we selected the low-cost monitors that selected that monitors the temperature and relative humidity, and we transformed that to the heat index. And I'll show the result. We only selected one day, August 7, 2020. It was 84 volunteers, 32 route. I was honored to be one of the volunteers, me and my wife actually, and we covered 3 routes in the day. And hundreds of thousands of measurements were measured in the city. This is the entire city. As you can see, it's only 30% of the city covered by the measurement, still largest in the country. And you can see the observed result are the routes that every volunteer goes using their car in 3 different time periods: the early morning, early afternoon, and early night, early evening. And we collected data for temperature and humidity, and we calculated the heat index. The model results were provided by CAPA strategy group. They used ensemble model of the Sentinel-2 remote sensing data, and some meteorological model, the regional weather model, WRF, with urban county model, and they fill out the communities that we were selected for the monitoring campaign. So this is actually one snapshot of the afternoon result between 3 to 4. And you can see that inside the Galileo, for those who are not familiar with the Houston, this is the Galileo region. And this is Houston downtown. And this is the ship channel. And the northern side of the city, the Arlene region, is the one that we get the most ozone, basically. You can see there are some hotspots of the heat index as well. The Galileo region is basically the one of the region that, in case of density, a lot of people live, including myself. I live in the Galileo region, and we get the highest temperature in early afternoon point. Okay. And this is the result for the afternoon model. The model version of that the measurement, as I mentioned, the CAPA strategies provide that region. And this is actually the zoom in version of the Galileo region, which has the highest heat index within that snapshot. And I think that the question that is unknown is that how we can use that data to, first of all, cover the rest of the city, which is 70% of the city, and second, to provide a strategy for the neighborhood-based intervention. So that's why we think of it, the Desert Research Institute and our CPO, the Climate Office Program. And we're working on the project specifically focused on that. We're developing a WRF urban capping model for the city. We're bias correcting that with a machine learning approach. And we incorporate the urban characterization using the Sentinel-2 data. And we also use the available amateur or professional weather observation data. And that will be eventually the AI-based digital twin that could tweak the different scenarios of at grid level for the neighborhood-based intervention, like cool roof and pavement and green roofs. So some of them are the regulations, some of them are recommendations. So you'll be trying to tweak the digital twin to understand which one works best for the different neighborhoods. So I will stop there. Thank you very much.
Now let's move on to our Q&A session. I'd like to invite all the speakers to the front of the room. Now let's watch the
Yes,
chat room.
for sure.
Any questions, comments? Yes.
I got a question for Arlene. I was trying to understand your predicted increase in PM 2.5 all the way out to 2100. We know that the primary sources of emissions are changing and decreasing. So is your prediction based on secondary formation or?
No, so let me explain. So yeah, thanks for the question. So that is under a very idealized scenario where the air pollutants and their precursors were held at 2005 levels. So we know already the air has cleaned since 2005, right? But basically it's an RCP 8.5 scenario, if that means anything. Ebrahim is using that scenario as well. And so we in the models that are set up that I was showing results from, there are some sources that would respond to meteorological changes, like dust, for instance. We actually don't have feedbacks from biogenic isotene, for instance. So there's things that are missing. Fires are held constant, right? So there's a strong feedback to climate change that certainly in the Western US is going to be important. But so really that was kind of focusing in on just how does climate change the meteorology in the Northeast US? It seems to do so in ways that all else equal would lead to higher PM 2.5 and ozone, at least in the one model that we had the ozone to look at. But yeah, thanks for your question, because I do think that assuming that we continue to work to clean up the air, hopefully those are more pessimistic scenarios. At the same time, I think it's sort of a little bit of a warning, right? That if things were to have frozen as they were at least in 2005, then we would have expected an increase in pollution just because of climate change.
Awesome. There's a question in the chat here from Jonathan Patz up in Madison here. He said he missed the first couple of minutes, but he wanted to ask if Arlene didn't mention, for baseline emissions, were any trends in decommissioning coal-fired plants used? Were results all from BAU at a fixed year?
So yeah, so I think for a similar question, I apologize for not making that clearer in the talk, but yeah, those were just the kind of standard RCP 8.5 emissions with frozen at 2005 levels. So no additional controls went into place. And had we run with the standard RCP 8.5 that includes the additional reductions in SO2 emissions, for instance, we would have seen cleaner air. So this was really isolating climate change at.
Yes.
My name is Madam Chao, and I'm a PhD student at University. Thank you also for the great talks. So my question is about the heat-induced mortality. Actually, two questions. The first one, what do you think are the leading cause behind heat waves? Are there like sufficient warning, like occupation or like other factors? And second of all, so because it is so interrelated with like air pollution and other factors, what are the approaches have been taken or like advices to separate and estimate the mortality that's actually related to heat waves?
And before answering that, if you could repeat the question before starting to answer, just for our Zoomers, that would be great.
So I wasn't sure who that question was directed to. So the first part of your question was
repeat the question.
yes. So the first part of the question was to look at heat waves and what the criteria are for looking at heat mortality. Am I summarizing it correctly?
Maybe I should,
Yeah.
sorry for too long. So the first question is, what are the leading cause behind just heat wave?
Okay.
And the second question, how do you separate heat wave induced mortality from like other things like air pollution, like also related to heat wave?
Okay. So the first question is, what are the mortality related to heat waves and what the criteria are, and then how do you separate mortality related to heat waves versus the other causes? So I'll take the second question first. So when we look at heat wave related mortality, and I think Chris also alluded this in his talk, is we are looking at hospitalization data, ED data. Those are some of the way we look at health outcomes. Those are the most easily accessible data, and those are data sets that use billing codes, right? So these are coming from health insurance billing codes. And that's what's accessible to state health departments and to most researchers. So heat-related mortality is not well coded, and death certificates in terms of just looking at mortality itself. Those are, and it may be actually Florida might have a better system of coding heat-related mortality. We don't. New York State doesn't see that as often. So that's one aspect is, just looking at that code for whether it's coded as a heat-related mortality. And the second aspect is looking at excess mortality during heat wave days. So, but then, again, going back to your first question, like how do you define the heat wave? And that criteria is set by the National Weather Service for each region. And what we found out in our research is the National Weather Service is using criteria that were set elsewhere, right? So they were using criteria that was similar to maybe Florida or hotter spaces, which when we looked at their criteria and looked at the heat-related morbidity and mortality in New York State, that wasn't sufficient. So we actually had to work with them, and actually the National Weather Service in their guidance to the regional department says that they should be working with their health departments to set these criteria. So it's like a whole circle where we are using their criterion to evaluate when mortality morbidity happen, but actually maybe those criteria are not set in stone and are amenable to change. And the same thing with how we measure heat is they use heat index. We are looking here at air temperatures at 2 meters, land surface temperatures, right? And we are now looking at wet bulb flow temperatures, which are not used by the National Weather Service. So we need to come together as a community to kind of decide, and then there is scope, and it's not set in stone. So there's scope for this flexibility and how those things that we just need to be talking to each other. So I don't know if the user assessments are accurate. So when we put these numbers out there, 700 that 12,000 that they might be higher. So we don't have a system to capture them.
Chris, want to add to that, or we move on?
I'm sure others can add too, but just quickly on the multiple pollutant exposure. For 2 exposures, potentially one could use like a causal modeling framework in epidemiology, and for ozone and temperature, for example, there are ways to sort of frame that as ozone's probably more of a mediator of that association and health outcomes. But I think it does get more complicated when you also throw in NO2 and PM 2.5 is from a different location out west, and you could probably also independently put that in a statistical model. But I think some of them, you're right. Beyond that, most studies I think just put it as another independent risk factor, depending on your framework, may or may not work.
Alex, any Okay, go ahead. Please.
I have a question for Chris. Where do you think the lowest hanging fruit is from a research design perspective on indoor heat? Yeah, just kind of general more thoughts on that. If you could expand to get that information.
Yeah, the question was on sort of what's the lowest hanging fruit for indoor heat exposures and health. And that one's right. Yeah, to be honest, probably partnering with a cohort study of an existing, there's been a couple of those 10 to 15 that have been published globally that do work with a cohort of people who have pre-existing health conditions, just to put relatively cheap but fairly accurate monitors in their households. But beyond that, unfortunately, that's beyond that, the sort of bigger picture, beyond working with EMS or an existing health data set, you have to combine outdoor temperature with the building model or energy usage and AC availability, which is probably not which is not the low hanging fruit. But I'd love to hear people's thoughts.
Different question for Ebrahim. I'm from Sacramento, California, and we recently completed a study of our own urban heat island effect. And very interestingly, one mitigation strategy that we stumble across is electrification of the vehicle sector. And basically, if you replace every internal combustion engine with an electric vehicle, you remove the source of heat, and it actually has a benefit. Is that something that you guys have done in Harris County, or could you do it?
Yes, a very good question. Actually, the question was regarding the mitigation strategy in California that mitigate the heat, potential mitigation of heat island effect using the electrification. And that's a very interesting thing for the Texas and Houston per se. We have some sort of guideline to do that. One of the current guidelines that is as a rule is there outside for builders of the construction building are having a white roof. So this is the only thing that we have here, and the Harris County and other neighbors county and other counties in Texas, they're working on the greening the space as well as other potential mitigation strategies. But we are working on the same thing. We have to answer the same question: if the electrification, or generally speaking, greening the energy sector, how that affects the urban island in the city. Actually, we recently started working our energy program, started working on answering the similar question in Houston Channel to see if that is the case. But in county level, I'm not sure. But there's still a lot of scientific efforts are trying to answer that question here.
I'd like to follow upon this question. I think we have two stakeholders here, representing two different regions, and then question from I forgot your name. I'm sorry. We also have a representative from California. So I was wondering, sort of following upon this mitigation strategy, within the United States. That have you guys sort of shared the resources? And I'm glad that Ebrahim mentioned about this digital twins. And I think from the data system perspective, from stakeholders' needs, have you guys share this kind of strategy together? Because different locality or state government, they have different strategy. But bottom line is to boost up the economy locally and also benefit your local residents. I was just wondering, are you guys sort of talking about this sort of sharing on a state level?
The great question. The question was about sharing the data and outcome of the research and for other people to use that. The answer is yes. Actually, all of the work that we've done so far and finished is outside. Actually, we're working on other projects at this time. I'm currently working on a web portal for a precinct 2 of the city. Precinct in Houston, we have, I think, 6 precincts. The precinct 3 is the largest one and most populated one. I'm working on creating a web portal for an 8th grader to understand. If they click on their address or type on an address, they can see the analysis of the history of air quality and the sources of air quality that they're living, and how that they can deal with it, actually. So these are the things that we are working with on our task force, and we will eventually share everything that we found, and the data will be available.
I will add that as a state agency, we collaborate all the time with other states. We've actually, specifically for this project, we collaborated with Vermont. We shared all our, all our code actually with them, so they could do similar analysis. The weather advisory change actually also affected Vermont. We worked with Florida on our project, so and New York City, and we currently working with Pennsylvania. We presented to Canada's climate and health program. The CDC, tracking program and the BASE program also gives us a great audience, so we can take the tools that we've developed and provide. And we actually also participated in NASA's RSET program to provide the training webinar, which is online now. These are avenues as well to share, to the research community what we've done, so that you can think about, how to partner with state agencies. So yes, and then going back to the energy question, we do partner with the New York State Energy and Research Development Authority, and New York State is actually looking at greening in the energy sector. A lot of that goal for emissions reductions comes from the energy sector. The climate impact assessment is housed in our Energy Research Development Authority. They're the lead agency on that. So there is a lot of connections going on, and they are looking at as these and greening of the gases is one of that. So as these are happening, they are also looking at these climate impact assessments and looking at the co-benefits for climate and health as these reductions happen. And the idea is to look at these policies specifically and then look at the change that happens, over time when these policies go into effect in these co-benefits. So.
My question was same basically. Okay. I was wondering what the policymaking process is of considering co-benefits and reduction strategies.
Yeah, I mean, that's a good story, right? That should be something that we should be sharing. There's a lot of pessimism in climate science, so the co-benefits definitely is something that's worth sharing and working.
I actually have a question for about the AI digital twin. Is that still evolving? Because I think when you evaluate potential mitigation options like green roofing, white roofing, you have to first train the digital twin in order for it to be able to respond, right? If you have a lot of training data already.
Yeah, that's actually a great question. The question was about the digital twin, how that the maturity of the AI that could be reliable on that thing. The answer is yes and no. The yes is if you have the final resolution. Assume that you have final resolution work model. In Houston, we have more than tens of thousands of 50,000 different grids in the city, and you run the model for entire year. This is a practical modeling scenario for a city like Houston. But this is what we have done. This is a lot of data, and actually here in the audience, I have a friend. He was my colleague in University of Houston. His work on the digital twin was for building a digital twin for a CMAQ model, the air quality model, and the preliminary results showed very promising accuracy. But still, it is no part of the answer is yes. It's pretty premature. But this is an evolving science. And this time the NASA, EPA, and NOAA, they're all interested in developing something like that. Maybe the digital twin, the board of digital twin, they both come from the Department of Defense project back in 2006, 2007, I think. Maybe that's a use of digital twin, but the idea behind that is to have an AI model that runs a lot faster and gets very close accuracy to what the physical model can do, at least like 1% of what the physical model can do. Like for example, air quality, if we have the digital twin that my friend developed, try to recreate the NO2 concentration in Houston. Having the NO2 concentration of CNITE is a tedious job of vision model, metrology model, and air quality model itself. It takes a lot of time, takes a lot of expertise. But the digital twin can produce the same NO2 model and NO2 concentration for the entire city in less than half an hour. Is it the same as air quality model? No, but it is could be useful.
We have time for maybe one more question or two short questions. Yes, go ahead.
I just wanted to ask my colleague from New York. You mentioned that these indicators are not collected in the health department. Again, going back to the co-benefit, how are you working with the health department to make sure they're collecting these indicators? Mortality due to age
So the question is, how is New York State specifically looking at health indicators related to mortality and thinking about co-benefits? I'll just correct that I am from the New York State Department of Health. The New York City has a separate department. But at the State Health Department, we don't really collect data on health, so we don't really go out in the field and collect data. These are coming from administrative data sets. Like I said before, these are looking at billing codes. What we have been trying to actively do is to see how these are coded. So kind of, thinking about how well are we coding these mortality and morbidity endpoints that we're looking at health research, and working actively with the SPOTS, which is our agency that collects these data. So, and kind of, trying to understand how well these codes represent this. Another challenges are, the changing of the codes from the ICD-9 to ICD-10. So we're developing the crosswalks to have those. And then, maybe some outreach needs to happen from health departments and maybe researchers, just as an agencies to say, we are looking at people's health. The research that we put out there, these are the health endpoints we're using. So when the clinicians or whoever is coding those, add the point there, or when the data being coded, they know to, that this needs to be, they need to be aware that these are being coded correctly because they have implications down the line for health research. So which I don't know if those connections have been made yet, but I think that's important. Yeah.
Anything online?
Nope.
Comments?
Oh, one
Oh.
last question too.
Go ahead. Go ahead.
So, have you guys looked at the health facility being impacted by this sort of urban heat island or air quality issue for your state in terms of this, climate change impact on cascaded down to local?
So the question is about health facilities and how they are impacted by climate change, and whether we've looked at it specifically. So yes, that's a consideration. We do outreach to health facilities. So when an heat wave happened, when an extreme heat event happened, we send out a letter to providers to say, this is coming down the line. Please make sure that these are the warning signs for heat illness, just to put it on the radar. But again, one consideration which as the Center for Environmental Health, we are not involved in, but the Department of State and, other agencies that emergency preparedness are involved in, is to look at how health facilities are coping with climate change. And that's, it's certainly an ongoing conversation as to, where are they getting their energy supply from, right? So in cases of brownout, blackout, and even other extreme events, weather events, and how are these connected? So there's certainly, we've talked about it and we're trying to, map those facilities, figure out what the access points are, where their energy grids are, do they have backup power? Those are, yes, certainly, not specifically that I'm involved in, but these conversations are happening. Certainly, obviously.
In the interest of time, I'm gonna wrap up the session. Let's give a round of applause to our speaker.